My name is Isobela Cuilin. I work for Empower in the Roma Intergeneration Project, and my role is Roma woman engagement worker. Today I'm going to share a little bit about my story, my journey in Ireland, and how I came to work in Empower. And then I'm going to present the project that I work in and my wishes for the future. So I think it's important to see someone from the Roma community working on the ground one-to-one with people. So I'm a bit nervous and I decided to read my story. Today I stand before you as a proud Roma woman who has walked a long and challenging journey. 27 years ago, at the age of 18, I arrived in Ireland, embarking on a path of resilience, learning, and transformation. My story is not just my own, it's the story of many Roma women who strive to break down barriers and redefine their place in the world. I was born in Romania under the communist regime, where life was shaped by strict tradition and loud culture norms. Especially for Roma women, our right was limited, and the expectation placed upon us were clear. Women were not seen as equal to men. We were taught to follow, not to lead, to accept, not to question, but deep inside, I always had a hunger to learn, to explore, and to grow beyond the boundaries that were set for me. It was not easy integrating into the modern world, meaning facing discrimination, misunderstandings, and moments of doubt. English was difficult for me, as it was my third language, and I carried the immense responsibility of my family, as a cultural expectation dictated that family and caregiving were solely a woman's duty. Additionally, integration was a barrier, as I was expected to strictly adhere to my Roma ethnicity. However, despite all this, I found the strength to break down and create my own path. Through the years, I have always been open, learning and expanding my knowledge. From the very beginning, even if I was uncertain about something, I never hesitated to immerse myself in a challenge, and I trust with the dedication and effort I will learn and grow along the way. However, as my children grew older, my English improved, and step by step, I began to integrate and engage more with the modern world. First, I started to work part-time to balance my family responsibilities, as cultural norms allowed. Then I took English classes, and I completed also additional courses, which eventually led me to the role I am today. Gradually, I became involved in various activities with the non-governmental organizations, such as Musicantia. I was a member of Roma community there, so this experience allowed me to step off of my comfort zone, meet people from diverse backgrounds, and engage in social interaction. Through this experience, I gained a deeper understanding of how organizations operate, and over time, I developed the confidence to take on a more active role. Eventually, I was given the opportunity to work in Empower, where I could contribute to my community in a meaningful way. So this journey has not only given me the knowledge, but also strengthened my ability to support others in my community. It has given me the confidence, increasing my trust in myself, and reinforced my personal growth. It was a continuous learning process, one that still shapes me today, through perseverance and determination. So, here I am today. The project called the Roma Intergeneration Program. We are 7 women workers there. 4 of us are Roma and the rest are Irish. And then we have big support from them. So 4 of us are based in Fingal, in Balbriggan, and 1 in Dublin 15. So the aim of the program is to identify the health, well-being needs of Roma, women, children and families, and reduce some of the barriers to access appropriate health and social care services. The purpose and function of the program is following, as we see on the screen. So it's to improve health, welfare, well-being outcome of Roma women, children, and families, to provide safe and secure environment for women and children to engage fully with services and receive information and advice, and empowering them to be proactive in their life. To develop and build capacity for peer-led intergenerational family support method, to provide child development, welfare and family support intervention, to focus on health promotion initiatives, especially in relation to child health, vaccination, maternity, women health, and service and screening, to mediate between Roma families and other services providers, bridging the gaps in services and supporting positive working relationships to ensure better outcome for children and families, and to collaborate with other services providers in order to provide a whole family response to emerging needs, and to reduce the risk associated with childhood poverty, families, and family. So the service offered the following support. The right-based advocacy clinic. So we run a clinic every Tuesday, and also during the week we have appointments. So we advocate on behalf of service users, so on health, housing, health. We support them filling and complete forms from different departments, and we provide information sessions. Sometimes during the year we invite professionals from different services, for example housing, common services, welfare rights, I forgot the name of the organization, but Threshold, yeah. So yeah, I'm nervous. Threshold, and we give that information to our groups and to our Roma community. It's easy for them to access them. So also we deliver some honest development group. So and based on their need, we run some groups. For example, healthy food made easy, driving theory test, swimming, English language skills, art and craft making, parenting and family support, like a baby massage, meditating and translation. We were close to Tuzla and child safeguard protection. So the Roma community are very afraid when they heard about Tuzla. So because they have someone from the Roma community and support them, they understand better the system, how it's working, and the approach is a bit different. So also we do education, we provide education and training. So this is internal. When people come to the service, we refer them to manual handling, safe paths, community development. We signpost them and refer them to the other appropriate services based on their needs. Also, we provide food poverty support, which in our group there's few families that they attend there and they receive a bank food from the service, and also child health promotion. So the outcome, you can see the statistic of in the screen from 2022 to 2025. It's a significant number of 701. It's every year, you can see it's in 22, 23, 24, and 25, how many numbers of family, adults, and children attend to the services to be supported. My wish for the future is to raise the voice of Roma women and girls, the positive lived experience from Roma women, children and families, a better education outcome for Roma children and young people, and stronger representation in the labor market. So This is everything that I have to share. Thank you so much.